them and how to overcome them. और आज हमारे साथ मेहमान खुसूसी डॉक्टर असफिया खलील साहिबा हैं। मैं डॉक्टर असफिया खलील आपको भी वेलकम करता हूं आज के इस प्रोग्राम में। आगे बढ़ने से पहले एक शॉर्ट में इंट्रोडक्शन रखता हूं डॉक्टर असफिया खलील साहिबा का, एंड फिर इंशाल्लाह फिर आपको हैंड ओवर करता हूं। डॉक्टर असफिया साहिबा, आप एक कंसल्टेंट साइकियाट्रिस्ट हैं। बेंगलुरु में 4 हॉस्पिटल्स में आप कंसल्टेंट साइकियाट्रिस्ट हैं। फिर आपकी एक फ्री मेंटल हेल्थ क्लिनिक आपकी एक मेंटल हेल्थ क्लिनिक भी चलती है। बेंगलुरु बेस्ड है आप, तो बेंगलुरु में एक रोटरी क्लब का एक चैप्टर है, उसके जरिए आपकी एक मेंटल हेल्थ क्लिनिक भी चलती है। उसके बाद फिर डॉक्टर्स फॉर ह्यूमैनिटी में भी आप के सर्विसेज के अंजाम दिए जाते हैं, और कई सारे डी एडिक्शन सेंटर्स में रिहैबिलिटेशन, यंग मेन और वुमेन को अल्कोहल और अगर दूसरे जो ड्रग अब्यूज है इसमें भी है ना आपका काफी काम रहता है। और आपका है ना एक खुद का डी एडिक्शन सेंटर भी आ रहा है इंशाल्लाह बेंगलोर में, और उम्मीद करके नाम से ये आने वाला है इंशाल्लाह। तो विदाउट फर्दर अडू, ऑन टू यू डॉक्टर असफिया खलील।
Thank you so much. Assalamu alaikum wa rahmatullahi wa barakatuhu. Today we'll be talking about addictions. So let's begin with the topic, what are addictions? So if you see that addiction it can be to any substance or to any behavior, and if that substance or behavior is being engaged in such a way that it is causing psychological and physical harm to the body, then it is called addiction. Okay. So now what are the different types of addictions? So we have drugs of abuse and we have behavioral addictions. So in drugs of abuse, you have legal substances. So you all know that some things are sold in the market freely, like cigarettes. You have, so that has nicotine in it. So alcohol is also sold freely in the market. You have inhalants. Inhalants are basically any petroleum product. So if you have, say, paint thinners at home or petroleum, or you have some jellies or some say nail polish removers, so all these are used as inhalant by addicts. And there are a lot of prescription medications. So what we prescribe for pain or for any cough or any other illness like a stimulant for patients with ADHD can also be misused by patients. And there are a few drugs of abuse which are illegally sold in the market. So those are cannabis. So cannabis is becoming very rampant these days. So it is also known as weed, pot, or even ganja, okay, marijuana. And next comes cocaine. Cocaine is like a white powder, and it is also known by a lot of other names like crack, C, then pot, it is also called as rock. And then you have opioids. So opioids come as heroin and brown sugar. And then comes hallucinogens. So hallucinogens are becoming very rampant these days. So you have PCP, LSD, MDMA, ecstasy. So all these drugs come under the category of hallucinogens. So now coming to behavioral addictions, which are becoming very, very rampant these days. And I'm sure most of you have joined in to see how we can deal with behavioral addictions. So they are mostly gambling. So earlier it started with only gambling. Now they have included a lot of other things like sex, technology, which includes internet, your mobile addiction, television, video games. So the kids these days are very much into it. And then next is pornography, then shopping and exercise. So these also can come under behavioral addictions if it is done over and above what is required. Now coming to causes of addiction. So causes of addiction is different from why a person or how a person gets to use the drug first. So it could be because of the friends, the peers who are using it. So it's always one person who is using it into the substance that he introduces it to another person. So a person who is sober gets introduced by a person who is already using it. And once a person uses it, say 100 people use it, only 10% continue using it. So the 90% of patients or people, they don't like the effect of addiction, or they don't like the effect of that drug, and they stop using. Only 10% continue it further. And even in that, almost 2 to 3 people get addicted to the drug. And who are these who get addicted? They are people with psychiatric illnesses or people with some stress. So psychiatric illnesses like, say, anxiety, it cures their anxiety. A person who is not able to perform socially, who's not able to talk, who's not able to, say, feel relaxed, uses the substance, feels relaxed, he feels that he's more confident and talks to people, and he gets addicted to these things because it is giving him some relief from his issues. Then people who are depressed, they have mood issues. They are not able to feel happiness. So when they use these substances, they get some relief, and say they self-medicate themselves and get into addictions. And people who have stress, any kind of stress, it could be physical stress, or because of their work, or some financial stress, or people who are exposed to trauma, like some, say, road accidents, or they have some abuse, sexual abuse or physical abuse. Just to forget these things, they start using the substance. And few of them have peer pressure because they want to be accepted in the group. They want to be with their friends all the time. So they start using the substance more and more. And
एक मिनट, आपकी आवाज थोड़ी स्लो आ रही है, और थोड़ी चैट में आ रहा है कि आवाज और थोड़ी जोर से.
okay, ठीक है. Second is availability. If the drugs are easily available, if it is at home, available at home, or just you come out of the house and it is available on your street, then the usage of it increases automatically. Then there are a few genetic factors, like people who have history of addiction in their house. So people who are their fathers or their brothers, their cousins, they are into addictions, then the person also has more chance of getting addicted to it. And few people feel rewarded, like they feel very good after taking the substance, and just to feel that reward more and more, again and again, they start using it. And we have poor role models these days. So children look up to movie stars, or say athletes, so who are again into addictions. So they are like openly telling or speaking about their addictions or usage of drugs. And this also kind of legalizes or kind of makes it more acceptable to the children, and they start using it. And second, the media has made it more acceptable. So it is not a taboo. Earlier, we could see that in the movies, only the villain was using these substances. Now, even the hero and heroine are using it. So it becomes more natural and more accepted and in thing to do. And so the children get attracted to it more and more. Now let's come to the prevention strategies. So as I said, that pressure or stress is one of the factors which leads us to addictions. So if we are able to deal with these pressures at home or in our life, then the chances of getting addicted reduces. So we don't teach our kids how to deal with life pressures. So we have to do that more and more. So life skills training is very important for them. And if a person handles pressure, if the parents handle pressure properly, and they show the children how to do it in real life, then the children learn from it, and they will use those strategies later on in their life. So when they are faced with a stressful situation, they will not buckle under it. And we have to teach our kids not to give into peer pressure. So we have to teach them it is okay to say no. So you have to say no, be different from your peers. You don't have to be cool, you don't have to be in, and don't give into such kind of pressures. So once it is offered to you, you have to learn to say no, and your body language has to be very strong when you say that. And for that, you need to develop close family ties. If the family members talk to their children about it and teach them the bad effects of these drugs and teach them how to say no, then I think children will not get into these habits. And developing healthy habits, it is not only for children, but even the whole family. If the family is engaging in healthy habits, then the children automatically come into it. And role modeling. We are our role models for our children. If we indulge into any kind of addiction and then ask our children not to do it, it will not work. So we need to be good role models. Plus, help our children accept better role models. So our film stars should not be their role model. So somebody in life who is doing good work should be their role models. And in some places, compulsory schooling becomes very important because the child is in a protected environment for at least 8 hours. Then schooling helps. So usually in the slums, compulsory schooling should be given to all children. And children should take up recreational activities after school hours. Like they could join some sports club, some hobby club, or some youth club, and be engaged in positive activities rather than going to these kind of activities. And make sure that the children are back home before it is dusk, so that they are protected in the house. And when they go out after dusk, it should be along with the adult, and it should be under adult supervision. So they have to spend more time with their parents. Connecting with their parents improves their coping skills, and it improves their um, bonding with the parents, and they will learn a lot of things rather than with their friends. And limiting their pocket money is very important, or even making them accountable. So whenever they spend money, you have to take an account of where they have spent the money and how they have done it. Now, sometimes you have to be vigilant with your children. You have to watch for signs of addiction, see whether their behavior is a little weird or not, whether they're doing well in their studies or not. Keep in touch with their teachers and check their belongings. So if you find some some suspicious activities or some suspicious substance, question them. Question them as to what it is and be open with them. And then educate the harms of the addictions. So it is us who have to tell them the harms of addiction. If they are exposed to these things by their peers and they are just exposed to the positive effects of these drugs, then they're not going to take it later on. So when you explain the harms, it will be very difficult for them to accept it. So be the first one to talk about addictions with them. And we have to generate awareness through plays, skits, songs, and nowadays social media, that is WhatsApp, Space, Facebook, and Instagram. All these things are becoming more important. Kids are involving more in these things. So some activity there, some flyers there will definitely help. And these things can't be done at an individual level. So these things you can do at home, whatever I've spoken till now, but you have to have your community support as well. All the communities in your area, in your town should work together to stop these kind of activities. So if you see some suspicious activities nearby or near your house, you have to do something about it. So all the members of the society, if they collectively take action, only then we can drive away these peddlers from there. If authorities are receptive to whatever you say, definitely you should report to the authorities. And there is a rule that tobacco products should not be sold 100 meters radius around the schools. So if this law is not being enforced, make sure that it is done. And it is the government's responsibility to have some stricter norms against drug trafficking. And they have to maintain vigil. Maybe police have to come and do vigils in your area. If there are some isolated areas where these activities are going on, the police vigil should be there. And we have to ask the government to reduce advertising about these drugs. And nowadays we have proxy advertisements. So the drug is not like advertised directly, but it is done in an indirect way. So those things should also be stopped. And we have to put pressure on the government to start more treatment centers where such patients can be taken and treated. Some de-addiction centers where people who are really too much into addiction can be admitted and treated, and rehabilitation centers. And lastly, you have to reduce the stigma of ex-abusers. That means when the ex-abuser comes out and he is sober and he's de-addicted, you have to accept him back into the society. You have to keep him in your company and give him more respect. That will help him to stay sober more often. Now coming to the treatment. So treatment is for, say, patients who are, there are three categories of patients. So one is people who are just using it for recreational purpose. One is people who are using it on a more regular basis. And the third is people who are completely addicted to it. So the first two categories can be just treated with motivational enhancement interviewing. So it can be done by, say, the health workers or people at home, or some NGOs can take up this and they can do it. And even parents can do it at home. And people who are completely addicted or who are taking it on a regular basis and they are not able to stop, they need to go to the de-addiction centers. And even in the de-addiction centers, the treatment can be done on the outpatient basis. So you don't have to admit all the patients. So you can give them medications to detoxify. That means remove the drug from their body, give them a replacement, medical replacement for the drug, and help the body come out of these addictions. Then give them anti-craving agents, which will stop their craving for the drug. And later on, we can do relapse prevention by teaching them strategies to stay away from these drugs. So you have to have refusal skills. You need to teach them how to manage their cravings. So what to do when they have such crisis situations and whom to contact. And some people, they have these Alcoholic Anonymous meetings, so they can attend those to stay motivated for a longer time. And there are rehabilitation centers where these activities do go on, and keeping in touch with them, or knowing where these rehabilitation centers are, the de-addiction centers are, and taking these patients to those centers becomes very important. And in the end, you have to teach your kids refusal skills, and addicts who are detoxified and who are in the who are like de-addicted, they have to learn refusal skills and practice it more regularly. Now coming to motivational interviewing. So I think this can be done by everyone. So even at home, parents can do this with their children. So when you're doing this, the first thing is talk to the patient or the child when he is sober, not when he is high with the substance. When he is high, he will not be able to comprehend anything, and all your efforts go waste. So when he is a little sober, you can start doing this. And first and foremost thing is, do not lecture the child. So do not lecture on the bad effects or what will happen if you take the drug. Let him talk. It is always better to make the patient talk, and you have to express empathy. Empathy means you have to say that, I understand what you're going through. I understand, I know, and I am here to help you. I love you, but I don't like this habit of yours. So make that very clear that you don't hate that person. You hate the habit of what he's doing. And after that, you have to avoid arguing with them. So whenever they start giving you the positive effects or some reasons for doing it, don't argue. Then you have to roll with resistance. That means you have to just listen to them, and whatever they say, just listen to it, accept it. And then once when they are talking and they make some mistakes, that means they say something, but they're doing something else. That is when you have to question them, that even though you have these objectives, you are not doing anything to fulfill them. Like you have to go and study, or you have to go for your higher studies, or you want to go to do engineering or medicine, but the amount of effort you're putting in that direction is not enough. So some discrepancy like that will crop up. This is just one example. It could be related to sports or some other activities, social activities, or something else. So develop that discrepancy, hold on to those, and whatever the patient says, you listen to it very carefully and pick up these things, and then you throw it at them. You change their statements and you present it to them in a different way. And you have to make them realize that they can do it. They are capable of doing it, and they have the efficiency, and they can stop if they are motivated to do it. So once this is done, I think most of the patients or the children will stop using these substances. And you have to talk to them in a very nice way, and you have to make them feel that you are there to listen. And whenever they have any issues, they have to come to you. Or you have to have a person in your family whom the child is closest to, and they can come and confide anything which has happened to them to that person. And you have to be non-judgmental at that time when they're doing it. So to conclude, we have to spread awareness about the harms of addictions. So that has to be done at a community level, and work as a community always, and provide treatment options. So nowadays, going to a psychiatrist itself is considered a taboo. So if you can remove that taboo, come to a psychiatrist freely, or to a counselor, or to a self-help group where these things are being done, that will help. Then seek government support, ask for government support, pressurize the government to take action against addictions, and stay vigilant in your area. Any suspicious activity in your area, you should be vigilant and garner support from your community and do something about it. And it is our fight. It is not an individual's fight. It is a collective fight. And nowadays, because it has affected all our lives, all of us have to fight against it. So let's do it together. Thank you.
Jazakallah khair. We had a brief idea about the substance abuses, कैसा होते हैं drugs, alcohol, and कैसा हम देख भी सकते हैं यार उनको जो addicted है उनको help कैसा कर सकते हैं, and ज्यादातर है ना सुनना है उनकी, फिर थोड़ा उनको है ना बताना है जो already addicted है. चैट में कुछ क्वेश्चंस आए थे, हम ये थोड़े क्वेश्चंस ले सकते हैं. एक तो ये है कि do we have a de-addiction center for Muslims as such, or do we have to utilize the one NIMHANS has been running for years?
Yes, it is true that we do not have a Muslim de-addiction center in Karnataka, but they are there in Kerala and in other parts of India. Maybe in Hyderabad it is there, but we are doing something about it. My center will start in another 3 to 4 months. So it will be mostly catering to Muslim population, where connecting to Allah and that aspect will be taken care of. So inshallah, very soon we'll be having our own center. Until then, we have to use the center which the government has or the other de-addiction centers. And we do have some centers where psychiatric treatment is not done at a regular basis, but they just keep these patients, say, in a madrasa and they treat them. So such centers are there in Bangalore.
अच्छा अच्छा जी. और जो है कि कॉन्टैक्ट नंबर ऑफ डॉक्टर इंशाल्लाह सफिया आपको चैट बॉक्स में हमारे कोऑर्डिनेटर्स डाल देंगे इंशाल्लाह. ठीक है. हाउ टू टेल किड्स रिगार्डिंग पॉर्न साइट्स या हाउ टू डिटेक्ट पॉर्न एडिक्शन, ये दो सवालात आए हैं.
See, if the children are closing their doors, they're not letting you check their apps, they're not letting you check their devices, and they are isolating themselves when they are using such devices, then I think you should suspect that addiction. And there are, I think, cyber security, I think you can put a cyber lock and not let the children access such sites. That is possible. So if you can do that, then I think it is helpful. And switch off the internet in the night. So when children are going to bed or just before that, so you have to have some hours like where internet is allowed. After that, it has to be switched off. So if you can control the internet that way, then you can definitely stop that addiction.
जी. और एक क्वेश्चन है. Okay, एक suggestion type है. Can we have another session on behavioral addiction? How do we differentiate between OCD, repetitive compulsive behavior, and addictions per se?
Nowadays, it is said that OCD and addictions, they come in the same spectrum, because here also activity is repeated multiple times. But in OCD, you have other symptoms as well. Like if the behavior is not limited to substance of abuse, but it is to other behaviors like washing hands, checking, or they have obsessive thoughts, repeated thoughts. So that is how we differentiate between OCD and addictions.
जी.
But the treatment is almost the same.
जी. कोई ओरली भी क्वेश्चंस पूछना चाह रहे हैं तो आप हैंड्स रेस करिए, इंशाल्लाह हम आपको ओरली भी पूछने देंगे। एंड रिक्वेस्ट है कि टॉपिक के रिलेटेड ही आप सवाल पूछिए, इररेलेवेंट सवाल बहुत आते हैं तो उसका अवॉइड करिए। एंड आप 30 सेकेंड्स में आपका सवाल कंप्लीट करना है, जो भी ओरली पूछना चाह रहे हैं सवाल। एक अभी क्वेश्चन है कि हाउ टू डील विद अ सेंसिटिव चाइल्ड where it is very difficult to deal as the child doesn't open up much.
If the child is very sensitive, better take them to the counselor. And if he's not opening up to you, to the parents from the beginning, then you have to suspect some autistic features or mental retardation or something else the child is having. So it is better you seek counselor's help at that time. So I cannot generalize and say one solution for that. It is better you take help of a counselor, diagnose the issue, and then you take steps in that direction.
ठीक है, जज़ाकल्लाह। अभी सैयद अतीकुल्ला आप सवाल पूछ सकते हैं। आपको अनम्यूट किया जा रहा है। रिक्वेस्ट है कि टू द पॉइंट एंड विद इन 30 सेकेंड्स आप आपका सवाल रखिए।
जी अस्सलाम वालेकुम, शुक्रिया नासिर भाई। शायद हाँ मैडम, तो 30 सेकेंड से थोड़ा सा टाइम मेरा इंक्रीज करिए, इट्स माय रिक्वेस्ट, ठीक है? क्योंकि मेरा एक मतलब रियल टाइम क्वेश्चन है, मेरे खुद ब्रदर का ये इशू है। मैम थे लास्ट टाइम बेंगलोर में भी यूथ विंग के प्रोग्राम में आपका सेशन था, तो मेरी कोशिश हो रही थी वहाँ पे भी मैम से क्वेश्चन करूँ, लेकिन वहाँ टाइम का बहुत शॉर्टेज था, तो इसलिए मैं नहीं कर सका। तो एक तो मेरे खुद ब्रदर का जो है प्रॉब्लम ये है कि वो 9 इयर्स से इसमें जो है ना वो ना ये एडिक्शन का प्रॉब्लम चल रहा है उनका मैडम, और वो मैरिड हैं और उनकी एक लड़की है, बट ये प्रॉब्लम की वजह से ऑलमोस्ट एक सेपरेशन उनके फैमिली का हो गया, और खुद हमारी फैमिली पूरे ब्रदर्स और पेरेंट्स हमारे, तो फैमिली का भी बहुत बड़ा इशू इनको टैकल करने में हो रहा। तो अब इनके हालत अब उनका प्रॉब्लम ये हो रहा कि उनकी जो है ना बॉडी की एनर्जी लेवल भी खत्म हो जा रही उनके, और उनको ऑलरेडी हम हैदराबाद और करीब में लातूर में हम और निमहंस में भी एक बार हम कंसल्ट करे थे वहाँ पर, तो डिफरेंट प्लेसेस पे उनको करे, और 2 बार उनको हम जो है डी एडिक्शन सेंटर्स में रखे ऑलमोस्ट 5 मंथ्स के लिए। तो जब तक वहाँ पर रहते हैं उनके अंदर तो डेवलपमेंट इम्प्रूवमेंट रहता, उनका रिकवरी रहती, बट वहाँ से बाहर आने के बाद फिर सिचुएशन वैसे ही हो जाती। अभी उनकी सिचुएशन बहुत ज़्यादा मतलब रहमदिल सिचुएशन है। तो अब हम फिर से उनको हमको डर ये लगा हुआ है कि अगर उनको ऐसे छोड़ दिया तो शायद ये चीज़ जो है ना
क्वेश्चन आपका, बिकॉज और भी लोग हैं तो उनको भी चांस थोड़ा हम देना चाहते हैं, तो जल्दी कंप्लीट।
जी, तो अभी आप प्रेजेंटली कौन से जो है ना रिहैबिलिटेशन सेंटर्स को मतलब सजेस्ट या रिकमेंड कर सकते हैं फॉर फास्ट रिकवरी एंड बेटर रिजल्ट? थैंक यू, जज़ाकल्लाह।
जब तक पेशेंट मोटिवेटेड नहीं है छोड़ने के लिए खुद से, हम कुछ भी नहीं कर सकते। आप कौन से भी सेंटर में डाल लो, यू विल नॉट गेट रिजल्ट्स। एंड देयर आर पेशेंट्स जो 3-4 बार या 10 बार भी अगर उनको रिहैब सेंटर्स में रखे तो वी आर नॉट एबल टू डी एडिक्ट देम, वैसे भी पेशेंट्स हैं। सो देयर इज नो वन सेंटर वेयर यू कैन गेट कंप्लीट रिकवरी। इट हैज टू बी फ्रॉम द पेशेंट, उनका खुद का मोटिवेशन होना चाहिए। तो पहले वो बिल्ड कीजिए। इफ ही इज रेडी, इफ ही इज विलिंग टू डू इट, तभी कुछ भी हो सकता है। एंड विदाउट इवन गोइंग टू अ डी एडिक्शन सेंटर उनको हम डी एडिक्ट करा सकते हैं। एंड राइट नाउ इफ यू आस्क विच इज द बेस्ट सेंटर, Kadavam's is the best center. Okay, after Nimhans it is Kadavam's which is number 1 in the whole of India. So वहां पे भी आप लेके जा सकते हैं। बट द रीजन फॉर एडिक्शन, जैसे मैंने स्टार्टिंग में बोला था कि देर आर अ फ्यू रीजंस फॉर एडिक्शन, तो उसमें क्या है, जब तक वो ट्रीट नहीं करेंगे इनका एडिक्शन कम नहीं होगा। he will not be motivated to stop. तो वो रीजन फाइंड आउट करके उसको पहले एड्रेस कीजिए, एंड देन यू कैन ट्राई टू डी एडिक्ट हिम।
जी, जज़ाकल्लाह खैर। जी जी, अभी नेक्स्ट आदिल नजीर, आपको हम अनम्यूट कर रहे हैं। रिक्वेस्ट है ये, विद इन 30 सेकेंड्स आप आपका सवाल रखिए और इंडिविजुअल सवाल मत रखिए। ऐसा सवाल आपका जो पर्सनल है या वगैरह, जिसकी वजह जो है ना दूसरों को फायदा ना हो वैसे क्वेश्चन से, तो वो अवॉइड करिए।
Assalamu alaikum warahmatullah. Yeah, my question is regarding, as you said, we should build our, community support. Most of the time, what is happening, our community is not familiar, like what substances are doing with the person's body, whether it is stimulant, depressant, opioids, or hallucinogens. I think because a lot of stigma is attached to it. And in our community support, most of the time they just oversimplify this issue. How can we deal with it? Because it is like a kind of escapist mentality, when a person is taking any substance. Just try to
See, by doing webinars like this, because our community, the ulamas of our community are not ready to speak on this topic, it becomes very difficult to garner community support, and it is not reaching wider audience. So I think if we do webinars like this or some live sessions like this, and be open about it, organize such things in your area, I think then you can garner community support as well as spread awareness about it. And you can have, for children, you can have some maybe painting competitions or essays or skits which highlight these issues and how to stop, how to say no. So if these things are done at your community level, so if you have kids around, you can organize such events for them, and that will also help.
जज़ाकल्लाह खैर। अभी नेक्स्ट ज़ैनब फातिमा, आपको हम म्यूट कर रहे हैं, एंड सेम रिक्वेस्ट है, अंडर शॉर्ट रखिए आपका क्वेश्चन, टू द टॉपिक, एंड पर्सनल मत जाइए।
Assalamu alaikum wa rahmatullahi wa barakatuh.
Walaikum salam.
Actually, I just want to know certain things, but I'm not sure whether I'm addicted or not for it. I like to talk to the people. I like to open up, but when I don't talk to the people, like I keep searching to whom should I talk, or sometimes I feel frustrated or overwhelmed mentally and feel sad or somewhat like that when I don't talk to the people. I don't know why it is. Is it normal?
See, that is loneliness and not addiction. Okay,
But
because you're feeling lonely and you want to be accepted, want to be seen and heard, you want to talk to people. So that doesn't come under addictions.
Okay, one more thing. Can I ask one more?
Yeah, go ahead.
What will affect a baby, child who is separated from her mother due to certain circumstance and being kept her far from her mother? Like not allowing her to stay with her due to certain scenarios, but whereas the child is willing to stay, will it affect her mentally?
Definitely, staying away from the primary caregiver definitely affects the child, and that is one of the stresses for the child, no? So the chances of addiction at that time increase.
Yeah, but she's taken care well, like multiple options she have given care, love, protection, everything, but she's willing to stay with the mother.
If the mother is the primary caregiver from the beginning and the child is feeling her absence, then definitely it is a stress for her, and it is a very big stress, especially if it is in the early ages of your life, no? The bonding with the mother is very important, be it some other caregiver, it doesn't matter, but mother's attention is very important for the child.
Thank you. Jazakallah khairan.
अभी एक क्वेश्चन हम ले लेंगे कि साइकियाट्रिस्ट also give medications, those can be addictive too. So what's the solution for that?
Use those substances as the psychiatrist prescribes. Don't use it according to your need. So whatever is prescribed and however it is told to take, you have to do that. And if you follow the prescription properly, you will never get addicted to these substances. Because I give day in and day out these sleeping pills, then anti-anxiety medication. So nobody gets addicted if they take it according to my prescription. If they stop some drugs, say if they have depression, and to cure their sleeping issues, depression has to be treated properly. So if they stop the antidepressant and just take the sleeping pill, they will definitely get addicted to the sleeping pill. So you have to cure the depression or the anxiety which is leading to this issue. So if it is done properly in the scientific way, there is no chance of addiction.
जी जज़ाकल्लाह। अभी एक अरशद हुसैन आपको अनम्यूट कर रहे हैं, आप आपका सवाल पूछ सकते हैं।
अस्सलाम वालेकुम वरहमतुल्लाह।
वालेकुम सलाम।
हेलो।
Hello. I cannot hear him.
जी जी।
ओसीडी के सिम्टम्स को थोड़ा सा एक्सप्लेन कर दें।
अच्छा, OCD यानी ऑब्सेसिव कंपल्सिव डिसऑर्डर। सो इसमें ऑब्सेशंस भी होते हैं और कंपल्शंस भी होते हैं। ऑब्सेशंस आर लाइक रिपीटेड थॉट्स के कुछ चीज गंदी है या फिर उनको कुछ छीने से उनके हाथ गंदे हो गए, तो वो थॉट बार बार आता रहता है। सो बिकॉज ऑफ दैट वो जाके हाथ बार बार धोएंगे, तो धोना इज अ कंपल्शन। सो दे कैन नॉट स्टॉप देमसेल्व्स। वो जितना भी कोशिश कर लें उनसे वो रुकता नहीं है। इवन दो दे नो दैट दे आर क्लीन, they're no longer dirty, they want to continue doing it. So the same thing happens to for checking also. They feel that they have not switched off the light and they keep checking that, or they keep checking the lock. They feel that they have not locked the thing properly. It could be a house, their bike or shop. They go back. Sometimes they reach home, they are not convinced, they go back to the shop, check whether they have locked it properly and come back. And before they sleep, they check whether the gas is off, the windows are closed, the door is locked multiple times. They will get up from their sleep and go and check. And some people take hours together to have bath, and they do it as a ritual. So they have a procedure to do it, or they take multiple buckets, like they need 20-30 buckets of water, they need one full soap, or the whole tank is emptied when they go to have bath, or they are not able to perform salah properly. They feel that they've done some mistake, or they have not done their wudu properly. They feel that they need to repeat it multiple times. So these are a few symptoms. Some people, they even store things. They want to just hold things, maybe some old tickets, some old newspapers and things which are not useful to them going further, but still they want to hold it. So that also comes under OCD.
Thank you very much.
If you have repeated thoughts, it could be sexual thoughts, it could be blasphemic thoughts against God or against anybody. So repeated thoughts are also part of OCD. And those are mostly like obsessions. There's no compulsion there.
जी जज़ाकल्लाह। अभी एक क्वेश्चन है कि काफी प्रेवलेंट है सोसाइटी में कि हाउ टू डील विद स्मोकिंग एडिक्शन, as it is quite more relevant in the society, plus it is much more harmful to others as well, passive smoking.
Ji. So you can do motivational enhancement therapy for them and try to make them leave that substance on their own. So if they are motivated, then they can do it. Second, you can help them to reduce the amount slowly. So if they are smoking cigarettes, you can ask them to smoke it at a longer interval, or once it is half done, they can throw it off, or they can use nicotine chewing gums instead of the cigarette, and slowly taper the nicotine chewing gums and stop. Then if they are doing it because they have depression or anxiety, then we treat that first. So once we solve that issue, they are able to leave smoking very easily. And ADHD people, so they are the ones who are addicted more. So once that is treated, the underlying illness is treated, it becomes very easy for them to leave. And motivation is something which works wonders. So any incident in the family or the person suffers some health issues, if you take that up and highlight it and tell them that this is because of your smoking, and if you stop, you will get better. Or if some say incident has happened in the family, somebody has passed away, or they've developed some illness, and if you can highlight that it is because of this habit, smoking, and if you don't stop, you're also going to be in that stage. That also helps people stop. But there's no one solution. So you have to try multiple things, and what suits that person, you have to kind of do the therapy accordingly.
जी जज़ाकल्लाह। अभी एक क्वेश्चन आया था, प्राइवेट में आया, वो ये, और पर्सनली मैं खुद भी देखा हूँ काफी सारे लोगों को, ये कि मोबाइल एडिक्शन कह सकते हैं लार्जर फॉर्म में, एंड शॉर्ट अगर और थोड़ा स्पेसिफिक है तो सोशल मीडिया या यूट्यूब या इंस्टाग्राम वगैरह। तो अब मैंने हालत ऐसी हो गई है इसकी कि एडिक्शन बोल के है ना, वो आदमी या वो शख्स एक्सेप्ट नहीं कर रहे, लेकिन सोने से पहले है ना मोबाइल हाथ में ही रहता, एंड लास्ट चीज मोबाइल करते करते ही है ना नींद लग जाती। तो आई एम श्योर ये लॉट ऑफ पीपल इन द ऑडियंस इसको रिलेट कर सकते हैं, उनके फैमिली मेंबर्स या खुद वो ही है ना, ऐसा देख सकते हैं कि मोबाइल छूटता नहीं है। और एक दो एक्सट्रीम केस भी एक आया है, तो उसमें वो बोले कि वो इतना एडिक्ट हो गए हैं कि इवन वॉशरूम भी जा रहे हैं तो ही टेक्स देयर, एंड वहां पर भी है ना स्क्रॉल कर लेते हैं। तो इसका है ना क्या क्या सोल्यूशन है, या इनिशियली हम क्या कर सकते हैं इसको ब्रेक करने के लिए?
See, इनिशियली तो बच्चों के हाथ में मोबाइल देना ही नहीं है। Until they are mature enough, don't give the mobile. So, even 1-year-old children, for them to eat food, so parents are giving it in their hand, playing some nursery rhymes or some videos and feeding them. तो वहां से ये हैबिट शुरू हो जाती है। And if parents are conscious कि उनको ये टाइम पे यूज नहीं करना है, and this is the time I will use my phone for, and then family time I'm not going to touch it, that also helps a lot. Children will also inculcate that behavior, and you have to be very very conscious and mindful about your usage and limit it as much as possible. और आजकल तो your mobile has become your television, your laptop, your say alarm, your friends are in that. So it's becoming very difficult for, and our job also. So all our I think most of the business calls, everything happen on the mobile. So it is very difficult to stay away from it. But if you have some boundaries and if you enforce it on yourself very strictly, then the children will also see that and they will also inculcate those habits. And it's becoming very difficult these days to leave the mobile for anyone. That is very true. All of us are going through that phase now. And after the pandemic, all the children have a phone. So because their schools were on that, it's become legal for them to use the phone. And now if you ask them, or now if you draw boundaries, it's very difficult for them to adhere to those boundaries. So if you put it on yourself, enforce it on yourself, and like switch off the internet during maybe after 12, or you have some timings and you switch off the internet after that, then definitely it will help you stop. But I feel the whole world is going through this phase. It's very difficult for anyone to come out of it.
जी जज़ाकल्लाह। अरशद हुसैन आपको अनम्यूट कर रहे हैं, अगेन टू द पॉइंट एंड अंडर 30 सेकेंड्स आपका क्वेश्चन रखिए।
मैडम ओसीडी का अभी आपने सिम्टम्स एक्सप्लेन किए, तो इसका जो वो है ट्रीटमेंट काउंसलिंग के थ्रू हो सकता है, या फिर जो है मेडिकेशन भी कोई अवेलेबल है, मेडिसिन वगैरह?
It has to be both. मेडिकेशन पहले स्टार्ट करके जब थोड़ा सा इम्प्रूवमेंट आ जाता है तब उनको काउंसलिंग के लिए भेजते हैं. So it has to be both counseling and medication. Both has to be done. And we have very good medications nowadays, so it can be treated.
जी जज़ाकल्लाह। डॉक्टर साहब आप ये स्क्रीन शेयर क्लोज कर सकते हैं क्या?
जी.
लुकमान अहमद आपको अनम्यूट किया जा रहा है, टू द पॉइंट क्वेश्चन पूछ सकते हैं।
Assalamualaikum. This is Shaban actually. Question ये है कि actually like these days this boys girls like girlfriend boyfriend का ये जो culture चल रहा है, तो इसमें without having a maturity, if a boy is behind a girl or same way, so it's like a sort of addiction only. तो इसमें आप कुछ मतलब you can put some points here so that can help mothers or parents to take care of their children, like because of the social media, WhatsApp, Facebook and all, so they are addicted to the phone, and that's the reason they are addicted to these habits. So how can this can be helped? Please give
You
your
have to go from negative addictions to positive addictions. Positive addictions यानी books हैं, sports है, extracurricular activities. So if you engage your children more in these activities and keep them busy with these work, and they have to be something which the family also engages in. So the whole, say, the whole, the family or their peers are engaging in such activity, then their chance of deviating to these kind of activities reduces. So that is all we can do. And if they are still deviating, then you have to talk to them and drive it into them that they are still immature and these things don't last, and they can do it once they are mature enough. So they can take their decisions later on, not right now. So if you can put these points across to them, plus help them to develop some good habits, some healthy habits, then it definitely helps.
जज़ाकल्लाह खैर। सादक हुसैन, आप सवाल कर सकते हैं।
अस्सलाम वालेकुम मैम, आई डोंट नो थोड़ा रिलेवेंट है या नहीं, अब आप ही डिसाइड करें। एक छोटा सा स्कूल है हमें, तो नर्सरी एलकेजी यूकेजी के एडमिशन्स हर साल ज्यादा होते हैं, प्राइमरी स्कूल है तो हर साल नर्सरी के एडमिशन्स में बहुत मतलब फर्स्ट टाइम किड जा रहा है ना, तो कुछ मदर्स बहुत ज्यादा ओवर सेंसिटिव होते हैं और बार बार कॉल्स भी करते हैं और फिर बाद में स्कूल्स भी बदलते बदलते रहते हैं, चले जाते हैं। तो हर साल के एडमिशन टाइम में हम फेस करते हैं, कुछ पेरेंट्स कुछ मदर्स होते हैं तो उनको ओबेसिटी प्रॉब्लम है, उनको क्या प्रॉब्लम है नहीं मालूम, तो हर साल बच्चे पर बहुत जुल्म होता है। तो कहीं भी सेट नहीं होता वो बच्चा बेचारा बेबी, तो उसके लिए कुछ गाइडलाइंस, आई डोंट नो, प्लीज, आई होप यू गॉट इट।
See, I got it, but you cannot generalize ना, हर issue, हर mother अलग है, उनके concerns अलग होते हैं, तो वो बच्चे को देखते हैं घर में and they are kind of very protective about their child. So that is why maybe they are changing schools or they are calling you repeatedly. But उनका concern क्या है and what the mother is facing, if she is having any psychiatric issue, वो देखना पड़ता है. So maybe they have delusions or they have some obsessions, तो उसकी वजह से ये बच्चे को ऐसे कर रहे हैं. And they are also maybe unstable, emotionally unstable, and they're not able to take their decisions properly. So तब भी ऐसे होता है. So each mother has to be treated individually, और individual case के ऊपर आप देखिए.
या मदर्स के लिए भी कुछ एक काउंसलिंग टाइप ऐसा आप खोल सकते हैं स्कूल में।
Yeah, all schools have counselors these days. So along with the children, even parents can be counseled.
जी, जज़ाकल्लाह। अभी एक हम फीडबैक ले लेंगे हमारे सेशन का, जस्ट 1 से 1.5 मिनट का। आपको जूम के स्क्रीन पे इंशाल्लाह सबको विजिबल रहेगा। 1 मिनट के लिए फीडबैक आप फिल कर दीजिए क्विकली, एंड इंशाल्लाह फिर हम हमारा सेशन रिज्यूम करेंगे। ऑर्गेनाइजर मुजम्मिल, थोड़ा फीडबैक अगर रिलीज कर दिए तो अच्छा हो जाता। मुजम्मिल, ओके, चैट बॉक्स में है, चैट बॉक्स में आपको फीडबैक फॉर्म है। ऑडियंस से रिक्वेस्ट है कि एक बार फीडबैक फॉर्म फिल कर दीजिए क्विकली विद इन 1 मिनट, एंड फीडबैक फॉर्म फिल कर आप चैट बॉक्स में थम्स अप डालिए। जैसे ही वी गेट 3 thumbs up, we'll resume the session inshallah. 1 minute का ब्रेक है फॉर फिलिंग द फीडबैक फॉर्म। जज़ाकल्लाह मोहम्मद फसीउद्दीन, आपका आ गया है फीडबैक। अभी 2 फीडबैक, एटलीस्ट 2 फीडबैक का वेट कर रहे हैं हम सेशन रिज्यूम करने के लिए। चैट बॉक्स में थम्स अप डालिए आपका फीडबैक फॉर्म फिल करने के बाद। ओके, और एक भी आ गया है। ओके, जुलेखा रजानी, आपको अनम्यूट कर रहे हैं हम लोग। टू द पॉइंट, आप थोड़ा क्वेश्चन रख लीजिए।
Assalamu alaikum. So, first of all, I have to thank you so much, Doctor, for being such a great, mashallah, because I've met you, I've come with my friends to your center, to your place for counseling, and Alhamdulillah, there are very few psychiatrists who take the very holistic side, who consider Islam as well as see the medical side. So, Jazakallah khair for being one in Bangalore and in the community. So you have been one of the inspirations for us to actually even pursue mental health as a profession. So as of now, Alhamdulillah, me and my friends are into counseling. So from your vast experience, which model or which therapy would you suggest that we should, train ourselves more in terms of helping people who come to us for mainly behavioral addiction? So a lot of people come to us with phone and addiction or porn addiction, and they cannot stop themselves. But like one of the sisters here mentioned, that they cannot stop themselves from talking to people. So they have certain behavioral patterns. So which model from your practice and vast experience would you suggest that we master to help out, such clients who come to us?
If you're asking for just one therapy, then it will be CBT. So if you can master CBT, most of the disorders, it can be addressed. So that will be one thing which you should look into.
Okay, CBT.
जज़ाकल्लाह खैर। जी, continue.
Mindfulness is also very becoming very popular these days. So mindfulness training is also very helpful. So you can keep in mind about these 2 therapies.
जी, जज़ाकल्लाह। खदीर शरीफ, आपको अनम्यूट कर रहे हैं, आप पूछ सकते हैं। शॉर्ट 30 सेकेंड्स में रखिए आपका क्वेश्चन एंड टू द पॉइंट।
हेलो, अस्सलाम वालेकुम।
वालेकुम सलाम।
मैडम, मैं सऊदी अरब में रहता हूँ। मेरे फैमिली इंडिया में रहती है। 2 लड़के हैं, एक है 2nd स्टैंडर्ड और एक दूसरा है 4th स्टैंडर्ड में। तो बच्चे मोबाइल के इतने एडिक्ट है मैडम, क्योंकि पेंडेमिक में वो स्कूल के तरफ से ऑनलाइन क्लासेस चल रहे थे ना, तो उसकी वजह से वो इतने ये हो गया। अभी रेगुलर क्लासेस, ऑफलाइन क्लासेस चल रहे हैं, तो भी बच्चे जो है स्कूल से आने के बाद मोबाइल मांगते हैं, ब्लैकमेल करते हैं उनके मदर। तो इससे कैसे छुटकारा पाया जा सकता है, ये मेरा क्वेश्चन था।
इससे आप छुटकारा तो नहीं पा सकते, लेकिन आप उनको उनका टाइम स्लॉट एक मुकर्रर कर दीजिए कि वो स्कूल से आने के बाद एक आधा घंटा यूज कर सकते हैं।
एक घंटा देते हैं मैडम हम।
हाँ, तो
you just 5 बजे आते हैं ना, तो 6 बजे तक देते हैं हम। फिर भी उसके अलावा और ब्लैकमेल करते हैं बच्चे कि और चाहिए, हमें कार्टून देखना है या कुछ देखना है, प्रोग्राम देखना है, इस तरह ब्लैकमेल करते रहता हूँ।
तो उनको पार्क लेके जाइए। शाम में अगर वो पार्क में जाएंगे और खेलेंगे तो इससे दूर ही रहेंगे, या फिर उनको कोई क्लास में डाल दीजिए, यानी कुछ सम एक्टिविटी, मे बी शटल।
पढ़ने में तो एक्सेलेंट है मैडम, पढ़ने में फर्स्ट आते हैं,
तो अच्छे हैं। स्पोर्ट्स में डाल दीजिए, सो विच इज मोर इंटरेस्टिंग एंड दे एंजॉय डूइंग इट। तो जब आपको कुछ और एंजॉयबल एक्टिविटी देंगे उनको, तभी वो फोन से हटेंगे। सो जब तक आप वो नहीं करेंगे तो वो फोन में ही रहेंगे। So you have to give them some other alternative, maybe give them some books to read or some physical activity outside. तो तब तक आप कुछ नहीं कर सकते। You have to take them to the park या फिर swimming में डालिए या कोई classes में, maybe cricket classes, some coaching class you have to put them into.
जज़ाकल्लाह खैर। लास्ट क्वेश्चन सैयद हमीदुद्दीन खादरी, उसके बाद हम सेशन को कंक्लूड कर देंगे। शॉर्ट रखिए प्लीज, टाइम बिल्कुल कम है, 4 मिनट बाकी हैं बस। हमीदुद्दीन खादरी, आप अनम्यूट किए हैं हम लोग। हेलो। ओके फाइन, अगर वो भी नहीं है तो नो प्रॉब्लम। अरशद हुसैन, शायद आपको ऑलरेडी चांस मिल चुका था। यहीं पर ही फिर हम क्वेश्चन आंसर सेशन को हमारा एंड करते हैं। जज़ाकल्लाह खैर एवरीवन। और अभी काफी कुछ क्वेश्चंस हैं, मगर अनफॉर्चुनेटली हमारा टाइम यहाँ पर खत्म होने आया है।
I think एक question था schizophrenia के ऊपर। So maybe somebody wanted to know whether it is treatable. जी definitely schizophrenia treatable है, curable नहीं है। तो हम उनको 80 to से 80% तक हम उसको क्योर कर सकते हैं, ट्रीट कर सकते हैं, बट 100% क्योर नहीं कर सकते। सो दे हैव टू टेक लाइफ लॉन्ग मेडिकेशन, एंड व्हेन दे आर ऑन मेडिकेशन वो कंट्रोल रहते हैं, पता भी नहीं चलता कि उनको स्किज़ोफ्रेनिया है। सो एक्सेप्ट इफ यू लुक एट देम वेरी क्लोजली, तो very good treatment is available. Definitely take them to a psychiatrist for treatment.
जज़ाकल्लाह खैर। यहीं पर ही हमारा क्वेश्चन आंसर सेशन एंड होता है। एंड कुछ थोड़े आउट ऑफ टॉपिक्स क्वेश्चंस थे, एंड शायद कुछ क्वेश्चन हमसे भी मिस हो चुके हैं। प्रॉब्ली आप ईमेल कर डॉक्टर साहिबा को पूछ सकते हैं इंशाल्लाह। जज़ाकल्लाह खैर। ऑडियंस का भी है ना बहुत एंगेजिंग था, क्वेश्चंस थे, एंड काफी इंसाइटफुल भी ये रहा ये सेशन। एंड मैं डॉक्टर असफिया साहिबा का भी मशकूर हूँ कि आपने है ना अपना वक्त निकाला यहाँ पर, और सोसाइटी में आपका बहुत सारा काम भी हो रहा है, और वही उस पर कुछ आपने यहाँ पर रोशनी भी डाली हमारे प्लेटफॉर्म पे आकर। जज़ाकल्लाह खैर। अल्लाह ताला से दुआ है कि अल्लाह ताला हम आपकी खिदमत को कबूल फरमाए, हम सबको ये सारे एडिक्शन से महफूज रखे, और जो ऑलरेडी ये एडिक्शंस में पड़े हुए हैं उनको इससे है ना बचाए, उनकी मदद करे, और एक हमको भी बेहतरीन उनका सपोर्ट का जरिया बनने की तौफीक अता फरमाए।